Good afternoon, and welcome to the Harvard Chan School of Public Health studio on this moist Thursday. I'm Pat Scarrett. I worked for many years at Harvard Medical School as a writer and editor. Then in 2014, became the founding editor of First Opinion Platform and the First Opinion podcast at STAT, which I managed until I retired from the 9-to-5 working world in 2023. Retiring gave me a lot more time for volunteering, which is why I'm especially excited to be moderating today's discussion on the mental and physical health benefits of altruism and pro-social behaviors. I'm joined by Ashley Whillans, the Volpert Family Associate Professor of Business Administration at Harvard Business School, and Laura Kubzansky, Professor of Social and Behavioral Health Sciences, Professor of Social and Behavioral Sciences at the Harvard T.H. Chan School of Public Health. Today's discussion focuses on pro-social behaviors. That's kind of an umbrella term for things such as volunteering, charitable giving, sharing, helping others, even donating a kidney. These actions or activities tend to benefit other people or society as a whole, and they're generally done in a selfless way, with the doer generally expecting no benefit. But as we'll hear today, there may be benefits for the doer. Laura and Ashley, you've separately been studying the physical and mental health benefits of pro-social behaviors. Ashley, can you cover some of the mental health benefits?
Sure, I'd be happy to. So my research takes an experimental approach to try to understand the causal impact of helping others on mental health. I've also done a little bit of research on physical health. A lot of our studies involve randomly assigning people to spend small payments of money on others for a period of time, and then look at the impact for happiness and health. I'll talk about the health one first and then well-being. So in one study, we randomly assigned older adults with high blood pressure to participate in a 6-week study. For 3 of those 6 weeks, they spent a payment of money on others or on themselves. We put the money into a prescription bottle that we could track so that we actually knew people were adhering to the study instructions. And what we observed is that older adults with high blood pressure reported significantly lower blood pressure at the end of the study when they spent money on others as opposed to being assigned to spend money on themselves. The magnitude of these benefits were similar to starting a new exercise program. And so we could see causal evidence from that initial study that helping others can produce physical health benefits. We also, in a systematic review we published in 2022, took the entire corpus of research on mental health and looked at all of the experiments done by researchers that randomly assigned people to either think about helping others or to actually help others, and then had looked at the happiness or positive mood benefits. What we observe is that there's a reliable effect between spending money on others in these causal experiments and positive mood, but that the benefits emerge most likely when people are actually asked to engage in a behavior. So we give them in a lab a windfall where they can go and spend that windfall on a goodie bag, either for themselves or to help a sick child at a local hospital, that those kinds of behavioral interventions are more likely to produce positive mood benefits as opposed to just thinking about the last time you helped someone. We also see that charitable giving opportunities that are focused on the direct impact, that highlight the direct impact to recipients, are more likely to produce mood benefits. And we also see that having some choice over how to help is also a key ingredient in producing the immediate mood benefits of pro-social spending.
Laura, how about you?
Sure. So I love Ashley's work because it's experimental, so it allows you to sort of say something about causal effects. But in the work that we do, where we've been looking at the role of pro-social actions and intentions on long-term health outcomes, it's harder to do these experimental studies, although I'll speak about one later. That has been done, because it's hard to sort of tell people, I'd like you to engage in this behavior for a while, and now I'm going to follow you out for like 30 years and see who develops their heart attack first. It's not terrifically feasible. So a lot of the work that's looked at pro-social behavior, and long-term health has done it using epidemiologic methods, so observational data with cohorts that are followed over a long period of time, and they take a group of healthy people and they ask them what kinds of activities they engage in or intentions they have. So they ask, how much do you volunteer for organizations to help others? Do you engage in charitable donations? Then they follow them out for some long period of years, anywhere from 5 to 20 years, depending on the study, and look at whether folks who have engaged in more of these helpful behaviors are at reduced risk for developing any number of health outcomes. And so the findings are pretty strong, actually surprisingly strong, with a number of outcomes that have been looked at, including cardiovascular disease, mortality. There's some more recent work looking at cognitive aging, so folks who engage in more volunteer activity, who are more prone to charitable giving, over quite a long period of time are less likely to develop heart disease, live longer, and have better cognitive health over the longer term. We've done some recent work where we've been looking at pain as well as an outcome, and it looks like people who engage in more charitable giving and more volunteer work also have lower levels of pain as they age. This is usually done in older adults. And in fact, we sort of looked at whether is more of these behaviors better. So people who volunteer got benefit, people who donated charitably got benefit, but people who did both had the most benefit, which is sort of interesting. Some very recent work we're doing, which we're still working on, has been looking not just at behavioral activity, because not everybody has the opportunity to engage in behaviors, but the intention or the feeling that one would be willing to do this given the opportunity. And in these long-term studies, that also seems to be protective, both for cognitive health, and it looks like we're going to have some findings on that with cardiovascular health as well. So these longer-term studies are pretty impressive because they do follow people over a long period of time. We measure the behavior just at a single point in time, and we still find that we're able to see a signal that it's protective. And there's a lot of discussion about what are the pathways and how does this work. And some of the pathway is probably through mental health. So by improving people's mental health, it downstream effects on physical health. A sense of purpose often gives people a greater sense of purpose, and more likely to feel socially connected, which we also know is linked with better health. So there's all kinds of pathways that we think are happening, although those are still to be worked out.
Well, as an aside, one of the things I was reading to prepare for this is that even something like stopping at a stoplight is considered a pro-social behavior. And so, all the little things that we do, just imagine all the little pro-social things you may do in your day and would never consider it to be a pro-social behavior.
Exactly. Yeah, I mean, there are so many opportunities for small and larger kindnesses. These are the behaviors that are kind of easy to measure. People have no trouble reporting, did you volunteer? They might forget if they helped someone cross the street, or they, stopped to pick up somebody's groceries, or, I was just traveling and, did someone offer to pull your bag down if you look like it's going to be hard to do, right? There's many of these small things that we probably don't even capture. So in some ways, the research it's amazing we see what we see, and there's probably much more that we could see if we spent a little more time looking.
And those kinds of behaviors in the diary research that's been done does show to produce mood benefits. And another path by which opening a door for someone or saying a kind word, these kinds of more daily, more micro actions can predict higher mood on days where you engage in those behaviors, is through stress buffering too. Right. So going out of your way or helping someone kind of either through social connection or just through this idea that if we are going out of our way to help, we might actually be more resilient than we think. The stress buffering path is also something that emerges in some of these studies as one route by which helping predicts these mental and physical health benefits.
So let's just take volunteering as an example. Do the benefits that accrue from volunteering, are they across the board, or are there certain conditions that you have to meet? Say, I volunteer at an organization called Community Serving that makes medically tailored meals for people who need special food. That might be good for me, but what if I told my kids, all right, you've got to come with me to community servings. And after the eye roll, which we're all familiar with, is there a benefit for that kind of volunteering?
Yeah, so we use the self-determination theory framework in our research, which says that people kind of have these fundamental human needs to engage in behaviors out of their own volition. And they also receive well-being benefits when they're able to connect and feel competent. So on that first dimension, if you sort of force someone to volunteer, there's research documenting that if it's more extrinsically motivated or even more self-motivated, so you're doing it to get a line on your CV or resume, or you're using it as a stepping stone to an opportunity to meet someone, that you don't see the same kinds of mental and physical health benefits. In part, I think, because people are then attributing that behavior to something they have to do. And so they're not thinking about it in the same way. So there's been some convincing, even research looking at mortality as the outcome, showing that people who have more other-oriented reasons for engaging in volunteering are less likely to die in this panel data. But if you're engaging in more volunteering for self-focused reasons, you look no different than non-volunteers and don't show that longevity benefit.
Though you did say when we were talking earlier that making kids do something can maybe set the stage for them doing it later as adults. So it's kind of a crapshoot, it sounds like.
Yeah, I would say, I think the findings are quite suggestive that you get more benefit if you're doing it, out of your own volition, and that it's matched to kind of something you feel good about. But honestly, in most of the research in the observational data, where we just say to people, do you volunteer? And basically they just say yes, no. And we don't know why they volunteer. So, my guess is there's a big mix of reasons for why people volunteer. And so it's possible there's still some benefit. I'm not sure you tell your kids you must do this and then there's the whole reaction, like that could be a little bit different. Although, to your point, my thought on kids volunteering, and many schools, public schools, have a requirement that they have to put in some number of hours of volunteering, and I'm always like, is that really helpful? But one thought I've had, and I don't know if people have looked at this, they might have, is kids who learn that they can volunteer and maybe discover that they like it, maybe more likely as adults to then volunteer for more of their own volition, at which point they may get the benefit. So I think that's an interesting idea of you set up a habit or you set up a pattern and a willingness to do it, and it also doesn't feel like it's so hard and foreign and things like that. So there could be reason to sort of try to motivate these kinds of behaviors, recognizing that there may not be the immediate benefit, but there may be some kind of longer term pattern that you're able to set up.
That's a better way to say it, to motivate somebody to do that instead of make them do that.
We tried.
Well, let's open the lens a little bit from personal health to public health. The Lancet Commission on Lessons for the Future from the COVID-19 pandemic showed that promoting pro-social behaviors could have helped limit the spread of SARS-CoV-2. How?
Right. Well, I thought that Lancet Commission was really, really fascinating in that they picked up this whole idea of pro-sociality, and they talked about how societies needed an ethical framework of pro-sociality, which I thought was really interesting. And the notion was that both individuals and governments should be more focused on the societal needs than on narrow self-interests, and that with that wider lens of what's going to be good for society, they would have made decisions that would have benefited the health of the communities and the society. So there were a few studies that found that folks who were more pro-social or more willing to engage in acts for others were more likely to wear masks. They were more likely to get vaccinated, which meant that their communities had less spread, which meant that fewer people, even if they were not wearing masks, were going to be infected. And so part of the commission was to say, it was a failure of pro-sociality in a sense. It was a failure of focusing on other. We were also focused on ourselves, and we should have really been thinking about how do we create a healthier society. And we sort of looked at that and said, because they were framing this in the context of infectious disease, which makes sense, right? There's transmission, and if I wear a mask and I get vaccinated, I reduce transmission of that infectious disease. But we were sort of looking at the work generally on prosociality and health, and also in the context of the pandemic, and said it's not just in the context of infectious disease, right? In the context of health more generally, there are so many benefits. And I sort of think of prosociality as a trifecta for health. So you have benefits for the individual who engages in prosocial activities. You have benefits for the recipient, right? So I now feel like someone cares about me and is taking care of me, and that is also a benefit to their health. And you have community and societal benefits where you are able to make decisions that are going to help more of the people in more different ways. So we sort of made the argument like, yes, prosociality would be helpful in the next pandemic, but we actually think it should be a public health priority because it has, so much reach in some ways, more than so many other things that we think about.
So that's making me think of Surgeon General Vivek Murthy's view of loneliness and isolation as a public health epidemic. Could what you two are describing, could that fit into fighting that epidemic?
Yeah, so our research has a lot to say about the way that we help and how that matters for the mental health benefits we receive. So when we're thinking about altruism as a conduit for well-being, we should think about how can we set up volunteer opportunities or charitable giving opportunities that allow people to connect. So my colleagues and I have done a lot of research on what are the boundary conditions around even financial generosity. When are they most likely to emerge? And so we see that the benefits of spending money on others lead to the greatest happiness gains when they facilitate positive social bonds between the receiver and the giver. So that's one. Two, for all of us, spending money on others or going out of our way to help does seem to have more mood benefits when it allows us to deepen our connections with someone you might consider a strong tie, someone that you know well. But there's also research suggesting that setting up donation opportunities for strangers to come together, to work together, to help, can also create intrinsic enjoyment and social bonding. So I think as we're thinking about developing programs that facilitate volunteering, or even thinking about how I as an individual might get the most happiness out of any one individual action I take, we want to be thinking about using volunteering, using pro-social opportunities in everyday life to connect with new people, to connect with recipients, and to strengthen pre-existing social bonds.
You were almost making me think of a hierarchy of financial giving, from the personal, $5 in the cup, to somebody sitting on a street. That's sort of person to person, as opposed to putting money into the Salvation Army buckets at Christmas time, which is one step removed from that. As opposed to writing a check, or for those of you who don't understand checks, sending money by Venmo or something else. My children have never written a check. So it seems like there are different levels of, and it sounds like it's because of connectedness.
Yeah, connectedness and competence. So going back to the framework I was presenting before, people like to know that the things that they're doing on an everyday basis are having a direct impact, that their actions are mattering. And so when you think about actually physically handing someone something, you can get more emotional benefit, in part because you can see that direct benefit. So we've done some research even, how do charities think about using some of these insights if they're sending simple messages? So in your Salvation Army example, we've run experiments saying your donation is going to help the Salvation Army help X number of million people this year. That's less effective to people than them understanding that their $10 donation is going to be used to fund, to help this one specific person. People get more emotional satisfaction in the latter case as opposed to the former, because they can see how their actions are directly benefiting an individual in their community.
It's still kind of, I find surprising that writing a check could give me, a lift.
So it's not as good. So one of my colleagues has a paper on the martyrdom effect. People would rather jump out of an airplane, even if it's less effective, because they're putting more effort in service of the action as opposed to writing a check. So there is, going beyond the financial example, people want to exert effort on behalf of causes that they care about. So there's ways of framing a charitable solicitation where you're more likely to get the emotional benefit, but moving beyond just thinking about financial generosity, people would rather jump out of a plane or run a marathon for causes that they care about. Those feel more meaningful than writing
And
a
so
check.
that's why physically volunteering, there's the effort there that you're talking about.
And the opportunity for connection.
Yeah, and to that point, I would say, I mean, especially coming out of the pandemic where everybody was so physically isolated, right? Sort of going out in the community and giving your time, not just giving money, right? But giving your time means you're probably interacting with people in some more meaningful way over a shared goal or, idea or a plan. There was a really wonderful study actually that was called the Baltimore Experience Course Study, which I wish I could say I was involved in, but I just admire it, where they actually took a bunch of older adults and they randomized them to help kids in under-resourced schools. So they were volunteering their time, they were randomized to either volunteer their time or not volunteer their time, and then they looked at the effects on these older adults after a significant amount of time spent volunteering, helping kids, and they were helping kids with things like literacy and, reading and all kinds of activities in the schools. And the results are really, really striking in terms of how much benefit these older adults gained from that activity, which was a very, interpersonal activity where, they had brain changes. They said the one of the findings was that it looked like they, slowed aging by the equivalent of 3 years in the brain, which was pretty phenomenal. They've looked at physical function. So the adults who engaged in who engaged in the volunteer program actually were physically healthier, had better physical function, better cognitive outcomes. They're now following them up to see what's happening with cardiovascular disease and dementia and some of these longer term outcomes. So pretty astonishingly powerful effects for what was, not an activity that seems so crazy out of range that none of us would ever do it, right? Like it was a sustained activity and it was something they invested in, but it wasn't, something wildly out of the ordinary. They had to fly to the moon and come back kind of thing. So I do think that, these kinds of activities do have the potential, for really enhancing social connectedness, reducing loneliness, and probably creating, more civil discourse in some sense, right? You're more apt to talk to people that you might not otherwise speak to and realize that actually we have more in common than we have differences, and that may be a good thing as well.
It's making me have subversive thoughts here. I think you said earlier, if people are doing it for their own self, then maybe they're not going to get the benefit for it. So should we not be telling people
it's good for their health?
We have, one of my colleagues did run a study telling people that giving was good for their happiness and they were more likely to do it. So happiness is something that people care a lot about. Happiness, connection.
Yeah.
And for whatever it's worth, there are studies of placebo effect where you tell people you're giving them a placebo and you say, this is a sugar pill. It doesn't do anything for you, and they still get a benefit. So on that idea, and nobody really understands why, and maybe it has nothing to do with the sugar pill, but like you're talking to someone and they're like, I care about you, I'm going to try to help you. All I have is the sugar pill, but they still seem to get this benefit. So one could argue on the same, idea that, someone could volunteer for multiple reasons, right? Someone could give their time or give their energy or give their their brain power, whatever. Partly because they're like, oh, well, this might be a way for me, to feel good in the world, but also because I want to help other people. And I suspect that, that's fine. You still get some pretty good benefit out of it.
So a question for you. Public health has long tended to focus on disease and risk factors. You and your colleagues have been making the case for attending to the positive, and that it's high time to make enhancing pro-social behaviors a public health priority. Why?
So great that you asked that question. So we have, been thinking for a long time. Public health does tend to focus on disease, which makes sense. Problems take our attention and we want to solve them. We also look a lot at deficits and risks in the environment. So we say, this is bad. There's air pollution and there's, all kinds of adversity that we confront and all these bad things that happen, and we talk about how they are problematic for health, and then the solutions are often to try to take those bad things away, which is really important, right? I mean, that matters a lot, and you want to identify things that are really going to cause health problems. But we spend a lot less time trying to understand what are things that will promote better health, and are these things we could add to the environment. So even if we can't take all the bads away, we could still add good things that will improve health, right? And we've also been saying that, we do talk a lot about what happens, how do people end up in states of disease and disability and death. But we have a little bit less of an understanding of how do you help people to stay healthy, to hold on to states of health, and what does it mean to be healthy at different ages. And if we understood that really well, then we could also understand better what are the factors that we would do, that we would add, right, or that we could, change with policy, or that we could change with organizational, commitments that would enable people to hold on to good health for longer, so that we're sort of less fighting backwards, right? Trying to constantly hold things off. So, we look at, as I said, we look at pro-sociality, and we feel like this is an incredible resource that could be built, in the sense that there are conditions and policies that can happen, all along the chain, starting at the societal level with policies by governments, organizational policies, community level activities, all the way down to the individual. So it isn't only up to the individual to say, I need to be a better person and I need to go volunteer, right? We want to set up incentives. And I know your colleagues have done some work in businesses about how do you set up incentives to kind of make it easier for people, reduce the barriers, so that if somebody wanted to do this, they wouldn't then say, oh, but I can't do it because I've got to work my 80-hour work week and there's no way I can engage in this kind of behavior, even though I would like to. And so what are the kinds of systems we could set up to make it more likely that more people in the population can engage in pro-sociality?
So that was going to be my follow-up. What are some of these things that can be done?
I mean, we've been doing some research on trying to shift the conversation in general around mental health and well-being from I-frame, so these individual level strategies and solutions, to S-frame, thinking more, how can we use existing infrastructure and provide support to encourage these kinds of behaviors, which are important for mental health and well-being. So we've been doing some research in Vancouver looking at how we might be able to build in charitable giving programs to the educational setting. So how can we take things like school and sports teams and infuse opportunities to help in those, to improve the program efficacy and uptake, like students' interest, but also to try to build in these habits around giving into institutions that already exist. And we're also doing the same for mental health in general in the workplace. So there's been a lot of innovation in the workplace in a lot of large companies to offer paid days off to volunteer, making sure employees actually do that, setting up opportunities for employees to do this in a way that would connect them to each other, and thinking about how we might be able to equip managers with training around well-being and mental health. So that's been a big focus area of mine, is how do we move the conversation even in workplaces from these individual strategies that force employees to take on the challenge of mental health and stress reduction on their own, to be thinking about treating this like an organizational concern.
Let's end by kind of going out here. And do either of you have advice or strategies for people who would like to be more pro-social, but haven't found their way to doing it yet?
So our research suggests that we think we need to help a lot to get any of the benefits. So we have a bit of an effective forecasting error. We think we need to give more money than we actually need to get the benefit. We need to help more to get the benefit of connection. And my advisor, former advisor, like to talk about it as we need to make time for social snacks. We need to make time for just like capitalizing on opportunities in our daily life to help others, to connect with those around us, and think about building up habits over time. So you can think about prosocial behavior, generosity, connection as small habits. So you could write a gratitude letter to someone you care about. You could hold open the door for someone. If you know someone is going through a hard time in the workplace, invite them for lunch or for a coffee. There's research suggesting that when we personally feel busy and overwhelmed, that's exactly when we get the most benefit from helping others.
Oh,
so there's an
interesting.
experiment where they randomly assigned people to spend 30 minutes on themselves in a way that they wouldn't otherwise, or to spend the 30 minutes on others in a way that they wouldn't otherwise. And the latter conditions of spending 30 minutes on others produce positive mood benefits, especially for people who felt stressed out and overwhelmed. Because when you're feeling busy, if you take time out of your day to help someone else, this helps you look to your own behavior and think, maybe I've got things together more than I thought I did. We feel a greater sense of self-efficacy. So I would encourage everyone listening to try to take 5 minutes, 10 minutes, $5, $10 out of their day or out of their budget. And something else we've also done in a more habitual way is you could think about having conversations with your kids. If you have kids, about charitable giving every month. So again, trying to build in this idea that my money goes to checking, savings, and charity, and trying to do that together in groups, either with work colleagues, joining a giving group, or at your own kitchen table.
Yeah, I would just reiterate, the work that looks at, these long-term health outcomes, mortality and cognitive aging and cardiovascular disease, often asks about both formal and informal helping. Right? Informal being these kinds of things like, I'm going to take someone out for coffee because they're having a really hard day, or I'm going to take somebody's, bag down for them, on the airplane, or whatever these maybe small acts are, but, multiple small acts add up. And so it doesn't have to be, I need to find the perfect volunteer opportunity, and if I don't find it, then I can't do anything. Or I need to give money to a charitable organization, because not everybody has that capacity, right? So partly is just sort of thinking outside of yourself, right? To say, what can I do for others that, could be very small in today, but maybe is larger in the next day. And also this modeling thing. I mean, you were saying, how do we get more pro-sociality in the population? I mean, I think governments can model it, organizations can model it, parents can model it, right? And again, that's lots of small acts. It doesn't have to be big giant things. I think we could scale up some of these programs, like the Baltimore Experience Corps that I was talking about, like make some of these a little bit more available and more formal for people if they want to engage in those things. So sometimes it's hard to find, ways to volunteer. You're like, well, I want to help, but nobody wants my time. They only want it between like 1 and 1:07 on Tuesdays, which I can't do, So I think, as a society, we could probably think a little bit more about that as well.
So the clock in the back tells me that we're out of time. Thank you all so much for being here. If you missed any part of the discussion or want to rewatch it, a recording will be posted on the Harvard T.H. Chan School YouTube page pretty soon. Have a great afternoon.